A big deal for little kids and a relief for many parents. Children 6 months of age to under 5 years of age can now be vaccinated for COVID after the CDC recommended Pfizer and Moderna shots for babies and toddlers. Pfizer requires 3 shots at present, Moderna just 2.
Now, this is the last age group to become eligible nearly a year and a half since the first vaccines were approved. Joining us now is Dr. Ashish Jha. He's a White House COVID-19 response coordinator. Dr. Jha, always good to have you here, especially today. You know, a lot of parents seem to be taking a wait-and-see attitude when it comes to their children. What can you say to ease their concerns about getting this vaccine for the little one?
Yeah, good morning, Gayle. First of all, thanks for having me back. What I would say to folks, and what I've been saying is, these vaccines have been thoroughly tested. Millions of children above the age of 5 have gotten these vaccines. They're exceedingly safe. And we expect confidence in these vaccines to build over time in this population. And so what I've encouraged parents to do is talk to their family physician, talk to their pediatrician, the people who take care of their kids, and have that conversation. And I think over time we're going to see a majority of parents ending up getting their children protected with these vaccines.
How common has COVID been in the little guys, number one? And number two, if you've already had COVID as a child, should you still get this vaccine?
Yeah, so COVID has been quite common in children. Actually, we think maybe almost 70% of kids have ended up getting infected with COVID. Still worth getting the vaccine. It really offers an extra level of protection, an extra layer of protection. What vaccines do is they keep kids out of the hospital. And that's why they are so effective, and everybody deserves that protection. So even if your child has been previously infected, the strong recommendation here is to go ahead and get your child protected.
Hey, Dr. Jha, it's Tony. A point of clarification here. You said talk to your pediatrician if you're a parent about these shots, but the pediatrician won't be the one actually administering it. Is that right?
No, many pediatricians will, Tony. This is one of the things that's going to look different in this campaign. We know that parents are going to want to get their children vaccinated in pediatricians' offices. Look, some people will go to a pharmacy, some people will go to a children's hospital or some sort of a community health center. But the bottom line is I think a majority of parents are going to want to get their child vaccinated in their pediatrician's office. So many pediatricians are going to be offering the vaccine.
And do you see these vaccines keeping up with variants? So parents get a 2-shot or 3-shot regimen this year, and then next year it's another shot, and then onward and upward?
Well, we don't know. I mean, we don't know what the long-term play on these things are. What we know is right now, these vaccines, despite the fact that we have various variants out there, are doing an extraordinary job keeping kids out of the hospital. That's why both CDC and FDA have been so enthusiastic. The scientists have been so enthusiastic about recommending these things. They're really making a difference. Over the long run, whether the vaccines will need tweaking or changing, we'll have to see as the virus evolves and as the pandemic evolves.
Any side effects for your kids if you get it?
It's very similar to the side effects we've seen for older kids or for adults. That 24 hours of some kids, just, they kind of don't feel as well. They feel tired. They don't have the same appetite. But thankfully, there have not been any serious side effects of these vaccines. And again, after giving, these vaccines to millions of children, it's really reassuring to know that for young kids, these vaccines are exceedingly safe.
All right. Well, I've heard that from reliable sources. My favorite grandson, Luca, will be getting one. So, Dr. Jha, we thank you for your time this morning.
Excellent. Thank you.